Mr. President.
Senator from Vermont is recognized.
President, let me begin by thanking Senator Casey for his consistent efforts in fighting to make sure that every American has good quality, cost-effective health care. He's been a leader on this issue, and I just want to congratulate him. Mr. President, I just want to touch on some of the health care issues that are out there, tell you what I think is positive in the bill that we are dealing with here in the Senate, and tell you what I think is not so positive. To begin with, as Senator Casey has aptly described, we have a system which in many ways is disintegrating. It is an international embarrassment that in the United States of America we remain the only nation in the industrialized world that does not guarantee health care to all of its people as a right. And the result of that is some 46 million Americans today have no health insurance. Even more are underinsured with large copayments and deductibles. We have some 60 million Americans today who, because of our very poor primary health care outreach network, do not have access to a doctor on a regular basis. And the result of that, Mr. President, as incredible as it may sound, is that according to a recent study at Harvard University, some 45,000 people die every single year because they don't get to a doctor when they should have, and as a result, by the time they walk into the doctor's office, their illness may be terminal. In addition to that, God only knows how many people end up in the hospital at great expense to the system because they do not get care when they should have. Meanwhile, as Senator Casey indicated, bankruptcy is an enormous problem because of our health care system. Close to 1 million Americans this year will be going bankrupt because of medically related bills. And furthermore, when we talk about economic growth in America, all of us understand that small businesses, medium-sized businesses are plowing an enormous amount of money into health care for their workers rather than reinvesting that money and expanding their operations and creating the kind of jobs that we need as a nation in the midst of our very deep recession. So we have got a major, major problem. And at the end of the day, despite so many people uninsured, underinsured, so many people dying because they don't get health care when they need it, so many people going bankrupt, we end up spending almost twice as much per capita on health care as any other nation. So it is clear to me, I think it is clear to the vast majority of the American people that we need real health care reform. And what real health care reform must be about are at least two things. Number one, providing coverage to all Americans as a right of citizenship. And number two, doing that in the most cost-effective way that we possibly can. To my mind, quite frankly, there is only one way that I know of that you can provide universal, cost-effective, and comprehensive health care for all of our people. And that is a Medicare for all single-payer system. And very briefly, the reason for that is that we are wasting about $400 billion every single year on administrative costs, on profiteering, on advertising, on billing, all in the name of profits for the private insurance companies who have thousands and thousands of separate plans out there, creating an enormously complicated and burdensome system. And each one of their thousands of plans, if you're young and you don't get sick and you're healthy, they got a plan for you. If you're older and you get sick, they got another plan for you. Got 1,300 private insurance companies with thousands and thousands of plans, and to administer all of this costs hundreds and hundreds of billions of dollars. That is money not going into doctors. We have a huge crisis in primary health care physicians, not money going into dentists. Many parts of the country, including Vermont, serious dental access problems, not money going into nurses. We have a major nursing shortage. This is money going into bureaucracy, into profiteering, into excessive salaries for the CEOs of insurance companies. It's going into inflated prices for prescription drugs in this country. And as a nation, we pay the highest prices in the world for prescription drugs. To my mind, as a nation, what we have finally got to deal with is that so long as we have thousands of separate plans, each designed to make as much money as possible, you are not going to get a handle on the cost of health care in America. And in the bill that we are now talking about here in the Senate, we have got to be clear that the projections, according to the CBO, is that everything being equal, over a 10-year period, the cost of health care for most Americans is going to continue to soar. That is the reality. And this is bad not only for individuals, not only for businesses, this is bad for our international competitive capabilities, because we're starting off from the position that today we spend much more than any other country, and guess what? While this bill does a number of very good things, it is not strong on cost containment. Mr. President, if we are going to do and try to improve cost containment, and I wonder how much we can do within the context of this particular approach to health care without being a Medicare for all single-payer system, at the very least, we need a strong public option. And we need that for two reasons. First of all, there is widespread mistrust of private health insurance companies for all of the right reasons. Most Americans understand that the function of a private health insurance company is not to provide health care. The function is to make as much money as possible. People do not trust private health insurance companies, and they are right in terms of their perceptions. People are entitled to a choice. If you want to stay with your private health insurance company, great, you can do it. But as many people as possible in this country should be able to say, you know what, I'm not comfortable with a private insurance company. I would rather have a Medicare-type plan. And I think poll after poll suggests that the American people want that public option. So that's point number one, freedom of choice. People should have that choice. If they don't want it, that's fine. Point number two, maybe even more important, if we're going to get a handle on exploding health care costs, somebody is going to have to rein in the private insurance companies whose only function in life is to make as much money as they possibly can. We need a nonprofit, government-run public plan to do that. And if we do not have that in this bill, I am not sure how you're going to get any handle on cost containment. So I will fight to make sure that we have as strong a public option as we possibly can. And as I have said publicly many times, my vote for this legislation is not at all certain. I have a lot of problems with this bill. And we've got to have, at least, among other things, a strong public option. Let me tell you something else that I think we have got to address in this bill. As I mentioned a moment ago, we have a disaster in terms of primary health care in America. Some 60 million Americans are finding it difficult to get to a doctor on a regular basis, and that is just dumb in terms of the health and well-being of our people, and it is also dumb in terms of trying to control health care costs. If somebody does not have a doctor that they can go to when they get sick, where do they end up? They end up in the emergency room. And everybody knows that the emergency room, by far, is the most expensive form of primary health care. And yet millions of people have no other options. They end up in the emergency rooms. If they have bad cold, Medicaid may end up paying $500, $600 for their visit to the emergency room. That is totally absurd. Furthermore, if you have a primary health care physician, that person is working with you on disease prevention, helping you with cigarette smoking, getting you off cigarettes, helping you with perhaps alcohol or drug problems, helping you with, a whole myriad of issues in terms of disease prevention, good nutrition, et cetera, et cetera. So that we have a disaster in primary health care, which is driving people to the ER rooms, makes no sense at all. As I mentioned the other day, there is a provision in this legislation in the Senate which authorizes a very significant expansion of federally qualified community health centers, which in a nonpartisan way, bipartisan way, is widely supported by, I suspect, almost everybody here in the Senate and in the House as well. And these community health centers today allow 20 million people to access not only good quality primary health care, but dental care, which is a huge issue all over this country, mental health counseling, a very big issue, and low-cost prescription drugs. Problem is, while the community health centers today do an excellent job, there are not enough of them. So in this legislation, we have greatly expanded community health centers. And if we as a Congress are talking about bringing 13, 14, 15 million more people into Medicaid, I am not quite sure how a struggling Medicaid program is going to accommodate those people unless we provide the facilities and the medical personnel to treat them. So we need this. We need to expand primary health care. Community health centers are the most cost-effective way I know as to how to do that. There are studies out there that suggest that by providing that kind of primary health care, keeping people out of the emergency room, keeping them out of hospital because they have gotten sicker than they should have gotten, we can in fact pay for these community health centers by themselves over a period of years by simply saving money. So in the Senate, we have very good language authorizing an expansion. In the House, they have similar language, except in the House they have a trust fund which actually pays for this. So I'm going to do my best to make sure that we adopt the House language which pays for, through a trust fund, a substantial increase in community health centers and, in addition, a very significant expansion of the National Health Service Corps, which is the federal program that provides debt forgiveness and scholarships for medical students who are prepared to serve in medically underserved areas in primary health care. We desperately need more primary health care physicians. We need nurses. We need dentists. That's what the National Health Service Corps. So my hope is that the Senate will adopt the House provision, which already has a trust fund to greatly expand the National Health Service Corps and the federally qualified health center programs. So that's an issue that is very important to me. Let me touch on another issue which is clearly going to be contentious. And that is, at the end of the day, we are going to be spending on health care somewhere around $800 billion to $1 trillion. And the American people want to know a couple of things. They want to know, is this going to raise our national deficit? And what CBO tells us is, no, it will not. More money is going to come in than go out. There will be savings incorporated into the legislation, and that is a good thing. So we have a $12 trillion national debt, and we do not want to add to that. But people are also asking, how are you going to raise? How are you going to pay for this thing? Where does the $800 billion to $1 trillion come from? And here's where we have a bit of differences of opinion. In the House, I think that they have once again done the right thing. And what the House has done is raised $460 billion with a surcharge on the top 0.3% of taxpayers. These are the wealthiest people in this country, and what the House has said quite appropriately is that at a time when the gap between the rich and everybody else is going wider, at a time when the top 1% earn more income than the bottom 50%, it is appropriate, especially after all of President Bush's tax breaks, to ask the wealthy to start paying their fair share of taxes so that we can provide health insurance to tens of millions of Americans. That, in my view, is exactly the right way to go. Unfortunately, in the Senate, we have not done that. What we have chosen to do in the Senate is to raise about, well, I don't know the exact number right here, but we have chosen to impose an excise tax of 40% on so-called Cadillac plans. Well, the problem is that given the substantial increase in health care costs in this country, a Cadillac plan today in 5 or 10 years may be a junk car plan. And I believe that with a struggling middle class out there, with people desperately trying to hold on to their standard of living, the last thing that the United States Senate wants to do is impose a tax on millions and millions of working people who have fought hard to get a halfway decent health care plan. Let me very briefly, Mr. President, just read right from a fact sheet that came from the Communication Workers of America. CWA is one of the largest unions in this country, and like almost every union, they are strongly opposed to this excise tax on health care benefits. And this is what they say, and I'll read right from it. This is a document from the CWA. The U.S. Senate will soon vote on legislation that would tax CWA negotiated employer health plans. The tax will be passed directly on to working families. To avoid the tax, employers will try to significantly cut benefits for active workers and pre-Medicare retirees. How the health benefit tax works, they're describing it. It's a 40% excise tax would be assessed on the value of health care plans exceeding $23,000 per family and $8,500 for an individual starting in 2013. Levels are higher for pre-Medicare retiree plans and high-risk industry plans, $26,000 and $98.50. These thresholds would increase, and here's an important point, because while people may not have to pay this tax in a couple of years, with health care costs soaring, they will have to pay this tax in the reasonably near future. These thresholds would increase at the rate of general inflation, plus 1 percentage point, or 3%. This is well below the medical inflation rate, 4%, and about half the rate, 6%, at which employer and union plan costs have been increasing. In other words, the cost of health care is rising a lot faster than inflation, which today is almost zero, may actually even be below zero. Point being that in a number of years, so-called Cadillac plans are going to reach the threshold upon which middle-class workers are going to be forced to pay a lot in taxes. Let me go back to the CWA now. They write, health benefits tax will hit CWA, and when they say CWA, they're talking about many union workers. CWA negotiated plans hard and result in deep cuts. In 40 of 43 states examined over 10 years, 2013 to 2022, the average excise taxes assessed on each worker in CWA's most popular plans will be $13,300 per active worker in the family plan. That's for a 10-year period, $13,300. $5,800 per active single worker, $13,600 per pre-Medicare retiree in the family plan, $4,300 per pre-Medicare retiree in the single plan. Bottom line is, the middle class in this country is struggling. We are in the midst of the most severe recession since the Great Depression of the 1930s. People are working longer hours for low wages. Middle class is on the verge of collapse. The United States Senate should not be imposing an additional tax on middle class workers. The House got it right. The Senate got it wrong. And, Mr. President, I intend to offer an amendment to take out this tax and replace it with a progressive tax similar to what exists in the House. Let me conclude, Mr. President, by simply saying this. I understand that the leadership wants to move this bill forward as quickly as possible. I understand that. But in my view, we've got a lot of work in front of us to improve this plan, among many other things, and I know other members have different ideas. At the very least, states in this country, individual states, if they so choose, should be able to develop a single-payer plan for their states. Because at the end of the day, in my view, the only way we are going to provide comprehensive, cost-effective, universal care is through a single payer. I know that some people are saying, well, we're dealing with health care. We're not going to be back for a long time. If this bill were passed tomorrow, trust me, we would be back in a few years because health care costs are going to continue to soar. Winston Churchill once says that the American people always do the right thing when they have no other option. And I think that's what we're looking at right now. We're running out of options. And what we put together is an enormously complicated patchwork piece of legislation. It's going to help a lot of people. It involves insurance reform, which is absolutely right. We've got a lot of money into disease prevention, which we should have. A lot of very good things in this bill. But it ain't going to solve, in my view, the health care crisis. Costs are going to soar. At least, if we don't have the courage as a body to take on the insurance companies, to take on the drug companies. At the very least, let us give states, whether it is Vermont, Pennsylvania, California, or other states, the right to become a model for America, provide health care to all people in a cost-effective way through a Medicare for All single-payer system. So we've got to do that. The other thing we've got to do, in my view, is get rid of this tax on the middle class by taxing health care benefits. Mr. President, you will recall that a year ago we were in a highly controversial and difficult presidential campaign. And one candidate who happened to have lost that election, a member of the Senate, Senator McCain, came up with a plan that was exactly or very close to what we are talking today. And the Senator, Barack Obama, who won that election, came up with a different plan. He said that wasn't a good idea. Well, how do you think millions of American workers are going to feel when they say, wait a second, the guy who won told me he was against taxing health care plans, and now we are adopting the program of the guy who lost? How do we have faith with the American people and people who voted in that election if we do exactly what we said we would not do? So we got to move toward a progressive way of funding this health care plan. So, Mr. President, you know, I sit here right now saying that this plan has a lot of good stuff in it, but there are a lot of problems in it. And I very much look forward to the opportunity to be able to offer a number of amendments to strengthen this bill. And it is very important, I think, to the people of Vermont, to people all over this country, that not only I, but you and other people have a right to offer amendments. Because if this bill just gets whizzed right through and is not as strong as it possibly can be, I think we will not have done the job that we need to do. Mr. President, with that, I would yield the floor, and thank you. It appears that I'm going to be closing here tonight, so let me
Senator from Vermont is recognized.
Ask unanimous consent that the Senate proceed to a period of morning business with senators permitted to speak for up to 10 minutes each.
Without objection.
Mr. President, I ask unanimous consent that when the Senate completes its business today, it adjourn until 9:30 a.m. Wednesday, December 9th, that following the prayer and pledge, the journal of proceedings be approved to date, the morning hour be deemed expired, the time for the two leaders be reserved for their use later in the day, and the Senate resume consideration of H.R. 3590, the health care reform legislation, that following any remarks of the chair and ranking member of the Finance Committee or their designees for up to 10 minutes each, the next 2 hours be for debate only, with the time equally divided and controlled between the two leaders or the designees, with senators permitted to speak for up to 10 minutes each, the Republicans controlling the first 30 minutes and the majority controlling the second 30 minutes, with the remaining time equally divided and used in an alternating fashion. Further, that no amendments are in order during this time.
Without objection.